Hi, I'm Scott Herdtner, Chief Financial Officer for CHI Health at Home, and I have with me today Ken Emrick, who is our Senior Director for Revenue Cycle, which is the area that is responsible for making sure we get paid, and he's specifically in our home medical equipment service line. What we're going to talk with you folks today about is just kind of an overview of healthcare in general, and then how home health fits into that. And then we're also going to talk about changes to how we get paid for what we do, because there's a lot of things that are happening in the industry. As you guys know, healthcare is an ever-changing and evolving industry. And then more specifically, we're going to talk about how is that impacting our home medical equipment service line. And Ken's going to provide some input on what are we seeing as far as the impacts in that service line, and then more specifically, what are we doing about responding to those changes? Because it's going to be important that we continue to adapt with healthcare as it changes. So I want to talk to you a little bit about healthcare in this country and kind of the importance that it plays in our overall national economy. In 2013, the Center for Medicare and Medicaid published that we as a country spent 17% of our overall economy on healthcare. So it's very big and it's very important, and it's not going anywhere. The other piece is, how do we fit into that big pie? So in the same year, 2013, home health expenditures were about $80 billion. So we're a big piece of a big pie. And I think the opportunity that we have here is that we're seeing an increase in utilization of home health services. So home health plays a larger and more important role in how we take care of patients in this country. So what we're finding is that home health is the place that folks want to be taken care of. So people feel more comfortable at home, and it's more cost effective. So there's opportunity for us as we move through, I think, the ever-changing and evolving healthcare industry. That being said, there are going to be challenges. As you see an increase in spend, what often happens is the government and or payers look to see how they can reduce that expenditure. So what we're finding in home health is that our payments are being reduced, not just from government payers, but the private payers. So as the federal and state governments are looking to kind of shore up their budgets, they're looking at places where they can make that happen. With healthcare being 17% of the economy, it's an obvious place where you would start looking to trim expenditures. So we're seeing a reduction in what we get paid for what we do. The other thing that we're seeing is the proliferation of these high deductible plans, which, long story short, what that means is the patient is becoming more and more responsible for the financial component, the payment of those services. So we're seeing smaller dollars and then more patient responsibility. What we're going to talk about today with Ken Emrick is how that's impacting the home medical equipment service line.
Good afternoon. I'm Ken Emrick, and I'm going to be speaking to you a little bit about some of the challenges tied to reimbursement specific to the home medical equipment industry. In today's environment, we look at there's three major challenges for us. Those challenges are, one, increased patient responsibility due to the lack of or to the reductions in insurance reimbursement. The second piece is regulatory, what we have to provide, the audits we go through that is making the business more complex and harder to manage. And the third piece is tied specifically to those reimbursement reductions specific to competitive bid. So let's talk about patient responsibility. Back in the day, the early 2000s, there's been studies done that on the low side, a patient's responsibility was 4%. That was their copay. It was the high of 10%. Now, as we move into the 2015 and beyond, we're seeing the low side at 10% with a high side of 55%. So we're seeing a dramatic impact on what you, me, we pay out of our pocket specific to our medical responsibilities. So that's one thing. So what are we doing to try and combat that? We, as a company, are now looking at how we take our business. We're putting more emphasis up front in capturing those co-pays and deductibles at the time of service. Second piece, regulatory. What's that? Well, with any Medicare program or any government program or really any insurance program, there's guidelines specific that we have to address when submitting a claim. Back in the day, It used to be if you had a prescription and you had a proof of delivery, you could submit a claim. Nowadays, we have to have more documentation. There's more information needed that have to be captured either from the patient or from the physician for us to be able to enable us to drop our claim and get paid. So what does this do? What does this trigger? We're seeing a lot more, or an increase, a 25% increase in the audits we're getting. This is a lot of additional audit work. It's a lot of additional work for the staff at my end. So the last piece, what's that third piece? That third piece is tied to reimbursement cuts. Reimbursement cuts are right now being driven by what we call competitive bid. This is a mandated program that's coming out from the federal government, that's coming out to all suppliers in the home medical equipment field. And essentially, they're stating to us that we are going to have to place a bid to earn that business. The expectations are that through this competitive bid process, that there will be a 40+% reduction in our reimbursement. So what are we trying to do to combat some of this? Well, one, we've ended our competitive bid and we'll continue to be a player in this market for the business. But two, we're also looking at our overall business model. You know, where have reimbursements shrank so much that it's no longer profitable business for it? So we're looking at the business lines we're in and getting out of some of those business lines in order to stay viable and focus really in on those product lines, one, where we still have good reimbursement rates, and two, where we continue to take and make money and keep the company viable and profitable.
So in summary, while there are changes and challenges in healthcare, we firmly believe that home care is the place to be in healthcare. It's where patients want to be taken care of, and it's becoming an ever growing and important part of how patients are taken care of across the healthcare spectrum. Healthcare is big. It's not going away. It's a vital and very important part of our economy and what happens in this country. And we believe we just have a tremendous opportunity in home health. So I think all roads point to a bright future for us. Thanks.